Hey everyone, welcome back to another I Care for Your Brain with Dr. Sullivan. Tonight we're going to be talking about a very important concept, which is self-care. Now this might relate to you as care that you give to another person or care that you need to give to yourself. And I want you to think about that because we often think of caregiving as something that happens from one person to another. But I want you to also listen tonight thinking about how this topic, this concept, can relate to the care that you give for yourself. As you know, we are here to talk about things that are needing to be talked about from a very educational and empowering point of view. So caregiving, let's face it, it's an emotional roller coaster. It is in many ways the noblest of pursuits. It is truly putting the action of love into practice, right? How is it that we truly, when push comes to shove and people really need us or we really need to care for ourselves, what does that mean? What is self-care as it relates to supporting and loving and making sure that the person has as much possible true love and support around them? That really is caregiving, right? But we also know that caregiving is one of the most taxing things that we can do to ourselves physically, socially, emotionally, and financially. There's all of these risks that go along with caregiving, and you're at much greater risk for the downside if you are stressed or burned out. So we have to get the word out about what does it mean to be a caregiver who is stressed or burned out. But of course, what do I really care about is what are you going to do about it? So I want to talk to you tonight about two fundamental shifts in the way that you think about caregiving that I hope will allow you to take some of the resources that are available to you that might have been hard to access before prior to this talk. So we definitely know that we have a continuum. We keep talking about spectrums in our time together in terms of caregiver strain. And on one hand, we have caregiver stress. On the other hand, we have caregiver burnout. So let's talk about the stress part. So stress, of course, is a little bit less pervasive and extreme as once you get to burnout, then really hard to come back to that. So I want you to be listening on the stress side, because if this sounds like you, we need to take action right away. The first one is just feeling really tired all the time. No matter if you get a little chance to have a nap, if you get a couple hours out with your friends, you come back and there's still that core of exhaustion that is feeling like it's taking up space in your body. The next one is feeling very overwhelmed and irritable. Even little things can kind of set you off. And part of that is that you're already up to here by the time the day even starts, before you even get out of bed. So things that are little stressors to other people can become absolutely enormous in your mind, and you can kind of blow your stack. Of course, that then leads to this terrible vicious cycle of feeling guilty and ashamed, which then of course makes your patience even shorter. And so it's just a downward spiral. Poor sleep, even if you do get a chance to get a nice long 8-hour stretch in bed with no interruptions, plenty of people who are caring for someone else have one ear out all night long, worrying, are they going to get out of bed? Are they going to be distressed? Are they going to try to get out of the house in some instances with like wandering and different types of dementia? But also being chronically stressed means you're going to have trouble sleeping for many reasons. But one is that when we're busy during the day, our worries can kind of get tucked away. And when our head hits that pillow at night, it's like they even become bigger, and our problem-solving abilities are poor because we're exhausted from the day. And so we can just get in this vicious cycle of kind of in and out of light sleep, and the worries are just pounding on our psyche, and it's a very awful feeling. Gaining or losing a lot of weight. Now, everyone is different in this regard. Some people get a lot of comfort from food and sugars and simple carbs. Other people lose their appetite completely. Losing interest in things that you used to enjoy. This is a really important one. Life is hard and life is a lot of work, but life should also be enjoyable and beautiful and have time to be appreciative of things. If it doesn't feel like you've been that in touch with the positive side of life, it's very important that you are aware of this and are making active steps to try to carve out some more time in your life and in your mind for the human being side of life, right? Not just the human doing side. Feeling increasingly resentful or angry is a very important symptom to pay attention to, because this means that you are not being supported enough. And I'm going to talk to you in a minute about, you got your primary supports, your family, your friends, but the truth is not everybody is surrounded by great supportive people. And so that's when you have to go to the professional side, the community resources, churches, doctors, county support groups. There's all sorts of things out there, but you have to know how to advocate for yourself. Becoming overly reactive, like I said before, just, even little things can really start to set you off. So now once we go over into the caregiver burnout side, this is where we start to see people neglecting their own needs, not going to doctor's appointments, not taking a break even when it's offered. There's almost this complete sense of learned helplessness, which is, this is the way my life is and I don't see any way out. And even if I'm provided with a little bit of a break or a solution, what difference is it going to make anyway? So very negative thinking. Having your entire life revolving around caregiving, but yet not finding meaning in that or not finding it very satisfying is a clear sign of burnout. Again, having trouble relaxing, even if you're given a little bit of a break, a caregiver can finally come to the house and you decide, well, this is a good time to do laundry. Okay, no, that's going to just get you further into that hole. We need to make sure you have the awareness and the self-respect to say, I need downtime. I need time to just go out and be. I cannot be doing all of the time. Feeling very impatient or irritable with the person that you're caring for. Again, this can also be yourself. And I think for me, the two words that really capture caregiver burnout is helpless and hopeless. Feeling like nothing's going to help and it's never going to get better. So the effects of caregiving, like I was saying before, are pervasive across all aspects of being, but physical health is one that has gotten a lot of attention in the literature. And so how we think of it, it's the combination of the loss that's associated with the caregiving, again, yourself or other people, the prolonged stress, the physical demands of caregiving, so thinking of it with another person, just getting someone ready for the day, getting them up and down, in and out of bed, in and out of chairs. This is really, really bad on your body, your back. It also makes it so you probably are not getting enough physical activity or exercise. Many people who are caregivers are not eating properly because they're just going, and then they get so starving, so hungry that they just put whatever is right there, which is typically, quick fixes, fast food, cookies, these kind of things, right in there. Then, of course, as we get older, we have a host of biological vulnerabilities that just come along with aging. Now, I take a very positive view on aging, but the truth is, there is more wear and tear, and we have more aches and pains, and it's harder for us to rebound from colds and flus and these kind of things. And when you're a caregiver, you just don't have that downtime. So, it gets so extreme that even our risk of premature death goes up significantly. So I wanted to give you this statistic. So being a caregiver and a spouse is one of the most difficult roles because there's a lot of loss that goes along that we don't talk nearly enough about in the roles changing from wife or husband to caregiver. So you got all the demands over here of caregiving, but yet there's all this loss and grief here for many people, not everyone, but for many people. And that combination is just very, very hard on the body and on the soul. So they did a study where they looked at caregiving spouses who were between the age of 66 and 96, and they reported that they were experiencing caregiver strain. They had a risk of dying that was 63% higher than people their own age who were not caregivers. So, I never want to use information as a fear tactic with you, but I do want you to know these statistics so you can be more motivated to do something about it. So let's just go through a couple more reasons why it is that, something as extreme as premature dying would be so much higher in caregivers. Well, the first one, and we've talked about this in other lectures, is the effects of chronic stress on the body are very significant. It's so easy to devalue the impact of chronic stress, and again, I've done a whole half-hour talk on this that you can go back and look at, but it affects our immune system, it affects our ability to get into deep sleep, stress hormones that are rampant in your body when you have a stress response that is chronic, that never ever, stress, our ability to respond to stress is meant to be a big response, and then you go back to baseline. And then maybe a couple weeks or months later, there's a big stressor, and you go back to baseline. Chronic stress is you never come down. You're always up here. So things like cortisol, adrenaline are always pumping through bodies in people who are chronically stressed, and they literally damage and shrink brain cells, okay? So it's not just like, you might gain some weight, you're not gonna sleep good. No, it literally affects brain health at that level. So the other problem, like I was saying before, is there's no ability to recoup and rebound when you're a caregiver because you're so focused on the care needs of someone else or your own care needs. I have to get up and I have to use my catheter. I have to do my feeding tube. I have to make sure I do my physical therapy. It's just a lot of output, right? So we don't get that chance to have that rejuvenation time. The other thing is caregivers are notorious for not going to doctor's appointments, not taking their own medications because they're so focused on the care of the other person. People then, of course, turn to quick fixes, not only food, but alcohol. And, my thing is I never, ever judge people who use substances because I truly believe that it's a person who's doing the very best they can with the resources they have available to them, and they are trying to change their brain chemistry because they are in pain. So if that resonates for you, don't feel shame about it. It's just a sign that you need some help and support. Caregivers are much more likely to have chronic illnesses like high blood pressure and high cholesterol, but not really manage them properly. We also know that between 46 and 59% of caregivers meet criteria for clinical depression or anxiety, and it's not treated. So that is the part of the lecture where I make you realize the stakes are very high. We need to be doing something about it. So there are two critical concepts that I want to go over with you tonight that really do require a shift in your thinking, a shift in most people's thinking. This is truly making yourself a priority and really working through your barriers in asking for help. So let's go through that. These things sound easy, but I'm telling you, we all have resistance to doing these things. So the first one is recognizing that you absolutely have to be a priority, okay? This is really more for people who are caregiving for someone else. So the reason you are doing all this caregiving is because your love is unbelievably strong. Now, it might not always feel like you are in touch with the love because caregiving is hard and it's human nature to get very, very irritated sometimes and very upset, and people who need caregiving can often be demanding and not even know it, right? So it's okay if sometimes you're not in touch with the love, okay? But the truth is, I think you have a very strong sense of commitment and love to this person. But that does not mean that they have to be here and your priorities have to be here. We have to at least have it be even, okay? So sometimes the only way people can think through this is by thinking about, well, what happens to you what happens to the person you're trying to care for if something happens to you, okay? So sometimes the only way I can connect with caregivers to take better care of themselves is, hey, what the heck is gonna happen to your loved one if you go down the tubes, okay? So if you have to think of it that way, that's fine. But the truth is that we have barriers towards recognizing that we ourselves have certain requirements for self-care. Okay, so I need you to examine, truly have some time in self-reflection to examine your attitudes and beliefs about what it means to truly make yourself a priority. Now, for some of us, this can be a lifelong pattern of being born into families where you were always the caregiver. For other people, it just feels like I don't have the time to do that. There's literally not enough time in the day. But breaking old patterns and overcoming these obstacles is absolutely not easy, but I promise you that it can be done. And this is where counseling can come in, because we're just going to be together for 20-30 minutes tonight. This is something that maybe has been a pattern for you for a long time, and you deserve the time and space to go through and really think about some of these questions I'm about to ask you. So I want you to really think about these, okay? You can even write them down and reflect on them later. And you have to be honest with yourself. That's the key, okay? Do you think that it is selfish to put your needs first in front of another person? Okay? Think about how you judge other people when you think that they are acting selfish. What does that mean? The next one is, do you have trouble asking for help? How does it make you feel when you have to ask someone else for help? It can make some people feel inadequate, like I can't do it by myself. It can make some people feel weak. Interestingly, a lot of people, in my experience as a psychologist, don't ask for help because they're actually afraid that their request will go unanswered, that it would make them feel very vulnerable to have to ask for the help when there's this strong sense of no one's going to respond anyway and it's not going to make a difference. And that's a very real thing. We can't live in la-la land with these recommendations. We have to stay practical. That is absolutely one of my values as a neuropsychologist, is I never want to make recommendations that sound wonderful in my office and then people leave and they're like, oh yeah, right, good luck, lady, welcome to the real world. I always want to live in the reality of what people are truly dealing with. So you're right, you may ask sometimes and your sister may not follow through and your daughter may not recognize how hard you're working, and then you're going to go to plan B, and we got to talk about plan B in a minute. So asking for help and accepting help is the second shift that I need you to really think about. Many people feel like they don't want to burden other people. It would be an admission that maybe you can't handle things all by yourself. But I really want you to think about if you really do think it's okay to ask other people for help, okay? And you have to really be honest with yourself about what that means. My experience is that there's definitely not enough help out there, that's for darn sure, and caregivers often live in many levels of darkness, metaphorically, and one of them is how hard they work every day and the hard things they do. But I also have been with people when someone close to them will offer help and the caregiver will quickly dismiss it and say, no, I'm fine, or don't worry about that. So one thing you can do is have a list of small to medium tasks for those people that maybe you just know at church, or maybe you just know someone who's an acquaintance. And then I want you to have bigger asks over here for people who really love and care about you. So little asks that you can have, like you're walking out of church and someone says, hey, I haven't seen your husband here. How are things going? Is there anything I can do? Have 5 things up here. You know what? I really need stamps. I mean, it sounds kind of funny, but these little errands that maybe are stressful. We could really use a visit on Sunday. It would just be great if you could stop by and say hi to him. Or, I have a doctor's appointment coming up. It should only be a half hour. It's a mammogram, and I think I'll be in and out. Do you think maybe you could come over and spend some time with him? Okay. Bigger asks come from family and close friends, and these are the, every Friday I would really like to be able to go have lunch with my book club. Once a month I know that I need to go and have a massage. My back feels like it's falling apart. Do you think you can help me with this? When you get no's from these folks, then I want you to go to Plan C, which are community-based resources. So I want you to think about calling your local Department on Aging, local senior centers. There are plenty of caregiver resources that are out there. I know that these things can cost money, but I also want you to know there are plenty of free services. My local senior center here, for example, has a program where they can give people, I believe it's 10 hours of caregiver support in a year. And I know that they don't have many of those slots, but I've also known in years past that they've had extra slots left over at the end of the year because people just didn't know about it. So any little help can be very, very nice for making a deposit in the self-care account. The other thing is that there are some free services where people will come to your home and do light housekeeping. So maybe not caregiving per se, but just something that will take a task off of your plate. And really, really, I want you to think about the way in which you ask for help. So this is really important. So most of us, when we are stressed out and resentful, resort to being passive aggressive. I'm convinced this is just a very normal, natural human state. When we build up feelings of not being supported over long enough, you're gonna lash out and it's not gonna be pretty. So I want you to think about assertive communication. And we've talked about this before too. This is not holding back completely until you blow, or being so aggressive that you actually alienate people. So there is a sweet spot in the middle. And the way I want you to think about it is it's giving respect to the other person because you're not being aggressive, but it's also holding on to some respect for yourself so you're not just feeling like you're being taken advantage of and that nobody appreciates you, right? That's kind of letting other people off the hook. If you are caring for someone, surely there's someone else in your family or friends that also has a responsibility to this person. Now, I know in families it gets very uneven and there's often one sibling, maybe that's you, who takes the lead, okay? You do need to have family meetings and try to maybe show them this video. Get them to appreciate that this is very, very hard on me and I need you to do your part, right? You can often find people who have parts that they're more comfortable with. There's the one person who wants to come and just hang out at the house. There's the other person who's the chef and wants to bring over a meal once a week. There's other people who would like to take to doctor's appointments. So there's all these different things. You have to figure out what's the best match for each different member. But with assertive communication, there's a couple guidelines. So I want you to think about using the I perspective instead of you, right? So saying something like, I'm feeling really angry that I'm not getting help, is really different and is going to be received differently than something like, you are making me angry because you never do anything to help me. So you want to get away from blaming, because that is immediately going to make someone feel defensive, and really try to be clear and specific about how the lack of support is hurting and affecting you, okay? This is huge, and I know so many of you do this, and believe me, I do it myself too sometimes, but the hinting, oh, well, she should have known what I meant by this. No, you have got to be direct. If you need help, you have to ask for it directly. Otherwise, you're going on the assumption that people are mind readers, and then you can get angry because they didn't pick up on the hint, and now you're locked into that passive aggressive cycle. Okay, so very important that you try very hard to be very clear in what it is that you're asking for. So when your request is not met with the enthusiasm and support that you thought, you do have to learn how to cope with that, and you have to recognize the person is not turning down you, they are not rejecting you, they are simply turning down your request for help. And it is extremely hard not to take that personal, but I do want you to recognize that one refusal does not necessarily mean they will never help you again. It may be that that task was not what they wanted to do, that that time does not work for them. So don't think you can never ask again, okay? I also want you to avoid doing something called weakening the request, which is basically saying something in a very hemming and hawing kind of a way, like, oh, well, it's just a thought. I was just wondering if maybe you had some time on Sunday to stay with Mom while I went to church, which kind of makes it seem like it's not that important to you. It's not really something that matters. But what if you used an I statement that was something like, I would really like to go to church on Sunday. I haven't been able to go for weeks. It makes me feel so much better when I'm done. Would you come to the house and stay with Mom from 9 until noon so I can go to church? Doesn't that sound a lot different than, maybe, do you think? And then when they say no, we can get super PO'd because they are not giving us what we want, but maybe we had a part in that and not making it sound important enough. So you have to understand that. The other thing is, what I'm saying to you today is about communicating emotions, right? Well, before you can communicate them, you need to understand them yourself. And with the big emotions, anger, resentment, exhaustion. It's very easy to simplify in our own minds what it is we're feeling, when really feelings are very nuanced. We often think of like 6 basic emotions, but the truth is there's more than 60 emotions. And so I want to introduce you to something called the feelings wheel. And this is actually super cool, super helpful. And I'm going to give you a link at the end of this post that you can click on to get a copy of the feelings wheel that we have created for you. And what I want you to do is print it out and put it on the refrigerator, put it in your journal, and try to become more of an expert in what it is you're feeling. So you're going to see it when you click on the link. And basically, here's the core emotion, but there's all of these little spokes that come out from that help you understand the sub-emotions that are underneath it. It was developed in the 1980s by a doctor named Gloria Wilcox, and it's just really a very nice contribution to self-awareness. The thing I want to leave you with tonight is this concept of self-compassion, that all of this talk about self-care has to come through a sense of kindness and softness about how we think about ourselves, right? It's so easy to give the best parts of our caring to other people, but you've probably heard people talk about this. You have to treat yourself as if you were your own best friend, right? Ignoring your pain, having a stiff upper lip is not going to get you anywhere. It's really important to sometimes just stop and acknowledge what I'm going through right now is really difficult. How can I comfort and soothe myself in this moment? Judging yourself, criticizing yourself for being inadequate, not doing it good, feeling like you're not even doing self-care good is not going to get you anywhere. I want you to take a very softened and kind of loving stance on this conversation. One thing that you're going to start to do different is this daily commitment to self-compassion, okay? And this comes in just little moments here and there. So finding little ways to bring physical comfort and pampering into your everyday. Now this can be something as lighting a candle, having a nice cup of tea at the same time every day in your best china, just showing yourself some degree of respect for your surroundings, I think, can go a long way. The other thing we can never forget is to find the humor in situations. Laughing is the most incredible stress reliever. Reading a funny book, watching a comedy, calling a friend that makes you laugh, wherever you can, trying to find humor in everyday situations is very helpful. Getting out of the house, being contained in a house is one of the most stressful things, and we kind of don't even recognize it. Fresh air, even if you have to open the window, try to bring the outside world in. At a more extreme level is trying to get together with people in your communities. I'm a big fan of support groups. If you can't get there in person, if you're watching me on Facebook, you've got no excuse to not belong to some of these amazing groups out there. Meditation is huge. That can be so helpful. If you can't get away physically, go, you have a fantasy of going to the beach, that's your special spot. There are all these apps out there that are completely free that can kind of take you there mentally. So the one that I really like is called Insight Timer, and it's completely free and you can customize it, and it's got beautiful music, but it also has guided meditations that can just kind of help bring your nervous system down. And of course, my last recommendation has to be sharing your feelings. It's not going to do you any good at all to stuff all this stuff in there. We are very interconnected social beings. We need to be communicating and talking and sharing with other people. So like I said, I'm going to put that link at the end of my talk here, but I'll tell you, it's www.icfyb, which is icareforyourbrain.com/feelings wheel. I'll have a post right underneath this talk for you to be able to click on it. If this information feels like it was helpful to you, if you think we need to be talking about self-care for the caregiver more, please do me the honor of sharing this on your wall or in any groups that you belong to. I love being here with you. It is truly an honor, and I cannot wait to see you guys next week so we can keep going with these really good conversations. Thank you so much for listening, and I'll see you next time. Bye-bye.